Hi everyone, welcome back in today's video. So in this tutorial I am gonna show you how to use the stethoscope to listen to the heart sound. So when you look at the stethoscope, we have the diaphragm and we have the bell. So we use the diaphragm to listen to high pitched sound, and we use the bell to listen to low pitched sound. So generally there are two main heart sound that can be heard during auscultation of the heart. That is S1 sound and the S2 sound, which is also known as the lap respectively. So in today's video, we're gonna look at how to locate the site for listening to the heart sound. And we're gonna look at the normal heart sound and the abnormal heart sound. So we have the S1 heart sound and the S2 heart sound. The S1 heart sound corresponds to the closure of the mitral and the tricuspid valve during systole. So during systole, ventricular pressure rises, leading to the opening of the aortic valve and the pulmonary valve, as well as the closure of the tricuspid and the mitral valves. The sound produced by the mitral valves is termed as the M1 sound, and the sound produced by the tricuspid valve is termed as T1. So the M1 sound is much louder than the T1 sound due to the higher pressure inside into the left side of the heart. The S sound corresponds to the closure of the aortic valve and the pulmonary valve. So we also have the extra heart sound, that is the S3 sound and the S4 sound. The third heart sound occurs during ventricular filling, which is also known as ventricular gallop. So it occurs generally in young adults and children at the age of 40 or under. So it can be normal or pathologic. Pathological conditions include due to heart failure, which include the following: ischemic heart disease, dilated cardiomyopathy, and hypertrophic cardiomyopathy, or mitral regurgitation. Okay, the S4 sound occurs when the atria contract against a stiff ventricle, such as in a state of ventricular hypertrophy, which is also known as atria gallop. So, pathological causes include hypertension, pulmonary hypertension, aortic stenosis, or hypertrophic cardiomyopathy. Okay, this is how you're gonna locate the area we're gonna listen to the heart sound. So for example, here are the clavicules. So these are the clavicules, and here is the first intercostal space. Then we have the second intercostal space. So this is the area where we are going to listen to the heart sound. So here is the second intercostal space in the right side of the sternum. So here is the aortic valve. Then we move directly into the second intercostal space in the left side of the sternum. Then we move in the third intercostal space into the left side of the sternum. Here is the Erbis point. Then we move to the fourth intercostal space in the left side of the sternum. So here is the tricuspid valve. Then in between the midline of the clavicle, so in between the midline of the clavicle, so you move directly down to the mid clavicle. So here is the mitral valves. So these are the area we are going to listen to the heart sound. So let us learn marks now. So I'm gonna mark them so that you are able to understand where we place the stethoscope whenever we are listening to the heart sound. So we have said earlier, here are the clavicules, then here is the first intercostal space, and here is the second intercostal space. So in the second intercostal space, right side of the sternum, here is the aortic valves. So here is the aortic valve. Then we move directly into the second intercostal space in the left side of the sternum. So this is where we find the pulmonic valve. So here we find the pulmonic valve. Then we move into the third intercostal space in the left side of the sternum. Here we form the Erbis point. So here is the Erbis point. Then we move down into the fourth intercostal space in the left side of the sternum. So here is the tricuspid valves. So here is where we form the tricuspid valve. Then in between the midline of the clavicle, so you move down in the mid clavicle. So here is where we form the mitral valves. So this is now how you are going to locate the area where we're going to listen to the heart sound. So we have said here is the second intercostal space in the right side of the sternum. We have the aortic valve. Then we move directly into the second intercostal space in the left side of the sternum. So we find here the pulmonic valve. And we move into the third intercostal space. So that is the Erbis point. Then we move into the fourth intercostal space in the left side of the sternum. So we find here the tricuspid valve. Then in line with the clavicle, we move down. So this is where we find the mitral valves. So this is how you are going to locate the area where we are going to listen to the heart sound. So now we shall be using the stethoscope on listening to the heart sound. So when you look at the stethoscope, we have the diaphragm and we have the bell. So we use the diaphragm to listen high pitched sound. So first we start listening by the diaphragm, then second we move listening by using the bell. So let us now, you place the stethoscope into your ear, then you start listening in the second intercostal space in the right side of the sternum. So you will hear a sound that is lubduk, lubduk, lubduk. Then you move into the second intercostal space in the left side of the sternum. Here is where we find the pulmonic valve. Then you move into the third intercostal space in the left side of the sternum. Here is the Erbis point. Then you move into the fourth intercostal space in the left side of the sternum. Here is where we find the tricuspid valve. Then you move into the midline of the clavicle. Here is where we find the mitral valve. Then after listening using to the diaphragm, then you start listening to the bell. So we start in the second intercostal space in the right side of the sternum. Then we move directly into the second intercostal space in the left side of the sternum. Then we move down into the third intercostal space in the left side of the sternum. Here is the Erbis point. Then we move into the fourth intercostal space into the left side of the sternum. Here is where we find the tricuspid valve. Then we move down in line of the clavicle. So this is where we find the mitral valves. So this is how you are going to listen. Generally we have the first heart sound and the second heart sound, and we have the third heart sound and we have the fourth heart sound. So the first heart sound and the second heart sound are the normal heart sound. So the extra heart sound, that is the S3 heart sound, and the S4 heart sound, these are the abnormal heart sound. So the S3 heart sound sometimes can be normal and it sometimes can be pathogenic. So mostly the S4 heart sound, that is the fourth heart sound, is generally pathogenic. It can't be physiological. So that is how you are going to listen to the heart sound. So, okay, these are the main heart sound that we normally listen during auscultation of the heart. So thanks for your watching and have a nice day.